From the studios of WALB, this is Healthcare Today with your host, Kelly Roberts.
Cancer, a word no one ever wants to hear. On today's show, we'll be joined by professionals who provide resources, support, and education right here in Southwest Georgia. I'm now joined with Dr. Brandon Siegel with the Veranda here in Albany, Georgia. Thank you for joining me today.
Thank you for having me. I'm very glad to be here and talk about screening and prevention of cancer.
Now, I know Southwest Georgia is home for you, and we're glad to have you back. So I'm not going to say welcome to Southwest Georgia. I'm going to say welcome home. You're originally from Lee County.
Yes, that's correct. I'm very glad to be back.
Okay. Now, you're correct. Today we're going to talk about what's really important for women to know. You are a gynecologist, and we want to talk about what are these things women need to know to hopefully prevent and make sure they're getting the proper screenings for all the different cancers they could be at risk for. Okay. So let's talk about you are the first line of defense typically for females, gynecologists, having these screenings. So how important is an annual screening?
Right. So as an obstetrician gynecologist, as you said, we are the first line in primary care, and particularly in cancer screening for gynecologic cancers and cancers that disproportionately affect women, like obviously breast cancer. The annual visit with the gynecologist is really important. We don't we don't screen every cancer each year, but it's important to have that visit because in addition to cancers, there's a lot of other gynecologic problems that can develop, and some of them have early symptoms that we can pick up and we can diagnose and treat. Okay,
so I imagine in these exams you spend time with patients like finding out family history and things like that are important?
Yeah. When you see your OBGYN, it's really important to give them your family medical history, particularly with regard to family histories of cancers. The cancers we usually explicitly ask about are colon cancer, uterine cancer, ovarian cancer, and breast cancer, but there are other cancers as well in males and in females in the family that can be part of hereditary cancer syndromes, for instance, Lynch syndrome or hereditary breast and ovarian cancer syndrome. And by providing your doctor with detailed information about your family cancer history, we can use that information to determine if you need specific genetic testing to determine if you might have one of those syndromes. That's really important because if you do have one of those syndromes, there are highly effective preventative measures that can be done to prevent you from getting an ovarian cancer or breast cancer.
Okay. And some of those screenings that most women are familiar with are like pap smears and pelvic exams and things like that. They're very important to do. So tell me a little bit about having those exams.
Yeah. So the pap test is one of the biggest accomplishments of human medicine everywhere. It ranks up there with like the polio vaccine, and it really does because cervical cancer used to be extremely common in countries that don't screen. It still is. In America, it used to be the #2 cancer killer of women. Right now, it's not even on the top 20 list, and it's because of the pap test. The virus that causes cervical cancer is HPV. Nearly everyone gets HPV. It's totally naive if anyone thinks they never got HPV. Nearly everyone gets exposed to HPV.
Okay, so that brings up a good point because we've seen a lot in the news about the HPV vaccine. And so talk to me about that. How important is that to have?
The HPV vaccine is extremely important, and it's being underutilized in America at detriment to the future of our young men and women essentially. The HPV vaccine is recommended for young men and young women starting at age 9. It can be given as sort of a catch-up vaccine all the way up to age 26, and it's most effective if given before sexual debut is what we call it. And the current vaccine that is available in America is called 9-valent, and it protects you against 9 different strains of HPV. 7 of those strains cause 90% of cervical cancer. And so if you get that vaccine, you can eliminate 90% of cervical cancer.
Now I want to switch gears a little bit and let's talk about ovarian cancer. Are there signs or any warnings women would have with that?
Right, so the early symptoms of ovarian cancer are vague and not specific, and so I'll tell you what they are. They're things like bloating, they're things like abdominal pain and distension, and a lot of people, men, women, everybody at some point they feel bloating, they feel some abdominal distension. It's very common, but what you should look out for is when the symptoms are new and they're not like anything you've had before, or when they're persistent. If it's a symptom related to cancer, it usually doesn't happen, last a few hours or a few minutes or even a few days. It will usually be persistent and get worse. And it is true that women who are really listening to their body and who get those symptoms and come to the doctor sooner are more often diagnosed at a little bit earlier stage.
Okay. And now I want to talk a little bit about breast cancer because, I mean, I know that is so important and early detection is important. But y'all actually have something at the veranda that helps. It's a 3D mammography. Talk to me about that.
Right. So you said a lot of things there that are important to hit on. Breast cancer is very common among women. On average, 12% of American women get breast cancer. There's very effective screening algorithms in place to test women. They rely mainly on mammography. The classical type of mammography is what we call two-dimensional mammography. You could think about it like an X-ray through the breast, looking for anything that looks abnormal like masses or calcifications. What 3D mammography is taking multiple slices through the breast of the image and you reconstruct that. And it's good for women with dense breast tissue and larger breast, and it does increase the sensitivity of mammography for detecting breast cancer. So the detection rate goes up a little bit with 3D mammography.
Okay, and another thing y'all do is y'all also have a radiologist that's there that'll help you look if you needed a guided biopsy, and that's done?
Right. So that's all about the interval of time between getting a screening result that's concerning and getting a diagnosis. And that interval of time is really stressful. And if that interval of time is too long, it could be worse for your cancer prognosis, right? Most early breast cancers are curable. And so it's important to make the time from an abnormal imaging result to a biopsy as convenient as possible. So that's why at the veranda we have 3D mammography, we have radiologists there, and we do the biopsies there under imaging guidance. And that's so that we can get patients in a convenient location that they know of, that they're comfortable. The cost may be less than other locations where they could get a biopsy. And we can get that time down and we can get them to answer faster.
Okay, very important for them to get in and get all this great information. I appreciate you sitting down with me today. We're going to take a quick break and we'll be right back.
Life is a beautiful thing. As women, we love experiencing life with peace of mind. Unfortunately, the diagnosis process of breast cancer can be slow and agonizing. But the veranda is here to help. With the most advanced 3D mammography and 3D guided breast biopsy technology in Southwest Georgia, the veranda is able to provide not only screening but a complete breast diagnostic center. Call the veranda today to discuss your options.
Dr. Anderson was my oncologist for 10 years, and he was the best. I was happy the day he declared me cancer-free and released me, but I told him I would miss the great care and compassion he gave me as a patient.
Welcome back, and I'm now joined with Dr. Eric Anderson, board-certified hematologist and oncologist. Thank you for being here.
Thank you for having me.
Now, I want to talk to you. You are located in Douglas, Georgia. Is that correct?
That's
You're with
correct.
Coffee?
Coffee Regional Medical Center. That's exactly right.
And then your specialty is treating cancer patients.
That's right. Yes. We treat all adult cancer patients, pretty much every type of cancer. We refer out a few acute leukemias to universities because they have a prolonged hospitalization for about 4 to 6 weeks, but all other adult cancers we treat. And we also see a lot of benign hematology, which is anemia, low blood counts, bleeding disorders that have nothing to do with cancer. But we do all that locally in Douglas.
You know, we see unfortunately, so many people we know, we're family members that we go to church with that are affiliated with having cancer of some type. So it's a benefit to have these services right here at home. How important is that?
It's just less hardship on the patients, less hardship on the families, and allows better continuity of care when you're looking at side effects from treatments and as they go through the spectrum of their illness.
Okay, and then with that, you've probably seen a lot of advancements in your years of treating cancer patients?
Absolutely. It's amazing. I came out of training in 2002, so just the last 16 years now, it's just been enormous changes. If the next 16 years are the same, you're going to see some just huge breakthroughs. The biggest things the last probably 5 years, the buzzword is immunotherapy. And you see all the commercials on TV. They have wonderful commercials for these drugs that stimulate your immune system. And we're using those in a plethora of malignancies. I mean, across the board, we're using immunotherapies, and they're tolerated in patients in their 80s, even I've treated people in their 90s with immunotherapy, and they do very, very well because it's a targeted therapy. It boosts their own immune system, and the side effects are much less, and they tend to work better than traditional chemotherapy.
And that goes along with, y'all have a new infusion treatment room at
That's
Coffee
right.
Regional Medical
That's right.
Center?
Yeah, at the hospital, we took 2 rooms, renovated them, and they're an infusion center. So we have full-time chemotherapy nurses. One was someone I'd worked with for about 7 or 8 years, even before I came to Douglas. And they do all of our infusions, they do all of our chemotherapies, all of our antibody therapy, and all of our immunotherapies.
And that's probably great too, to be right there. Like you said, you're there,
It is.
the nurse is there,
We're
they
there
get used to the
full-time,
patients.
absolutely. So it's wonderful. It's been wonderful. Just the community's been just extraordinarily supportive. I think they're excited to have a program there, and it's been fun from our standpoint because we have a full-time office. I have a nurse practitioner that works with me full-time. Our staff, like I said, not only that one nurse, I have another nurse that came to work for me that worked for me for 7 or 8 years. So it's kind of a family getting back together and starting a program in an area that really needed it.
Okay. And I would imagine when that patient comes to you, they've had some type of formal diagnosis.
Usually.
So, I mean, that's got to be hard conversations to have when they come
is.
see with you. Talk to me a little bit about that.
That's, I tell you, that's the biggest thing coming out of training they don't teach you. Because usually your attendings do that in training. So it took years for me to figure out the best way is just to be blunt and honest with people up front. You don't sugarcoat it. You offer them hope, but you have to tell them the truth. I think the worst thing you can do to a patient is just tell them something, give them some false hope because you don't want to hurt their feelings. And most people, to be honest with you, would rather know the truth up front. My patients hear me say the same kind of catchphrases over and over. So that I had a patient yesterday, as a matter of fact, and I told him the truth about his cancer, his prognosis, and I said, look, I know that's a lot to hit you over the head with, but my job from here on out is to be a cheerleader for you. Mm-hmm. So I'm going to push you on. We're going to encourage you. It's not all going to be negative things, but you need to know up front because your family needs to know and you need to make some plans. So it's just a balance, trying to figure out how to encourage them, but also let them know the truth.
We previously were speaking to a physician about the first line of defense being these annual screenings.
That's right.
So I want you to give some advice to these patients about how important is that?
That's the number one thing. I mean, we treat cancers a lot of times already spread. We're not going to cure patients in that situation. We may buy them time, and some of these immunotherapies are buying patients long periods of time with cancers that used to be fatal pretty quickly. But the key is catching things early. Most cancers, if caught early, can be cured. Whether that's colon, breast, or even lung cancer has a chance of being cured if it's caught early. So the key is, we see a lot of patients that have ignored symptoms. You'd be amazed at the patients that come in with knots on their neck or a knot in their breast that they've just ignored for 6 months and thought it would go away. And if it had been diagnosed 6 months earlier, the prognosis would have been different. So the key is getting mammograms when you're supposed to, getting your pap smears. Even smokers, there's a screening for smokers. It's a low-dose CAT scan that Medicare and insurance companies pay for if you smoke to catch lung cancers early. But the key, that's definitely the key. Follow your primary physician, let them do your screening, but you have to go to the doctor to get those done. And some patients just have an aversion to going to doctors.
Yeah,
and that's understandable.
They don't need to ignore those, right?
That's
because
exactly
you
right.
could potentially catch something.
Oh, absolutely.
And help, the curative care could help it.
Absolutely.
Now, talk to me a little bit about, I know, like you said, you offer different treatment options.
Yes,
So probably, but every patient, I mean, it's going to be a specialized plan, right?
Absolutely. And the other buzzwords, personalized medicine these days, or personalized oncology. A lot of cancers these days, in my analogy to patients, is a lot of cancers have keyholes on them, and we have the key to the keyhole. But the key is testing the cancer to see what the options are. So some cancers can come in, you still use traditional chemotherapy, you can still use traditional radiation, and that still may be the best front option. But if they progress or recur after, there's targeted therapies that are pills, they're monoclonal antibodies, they're immunotherapies that have less side effects, and they work better sometimes than traditional therapy. So you're seeing these personalized programs for patients, and really you can get this anywhere. I know they're offering it here in Albany. You go to Emory. It's chemotherapy and treatments are very standardized these days. So we send off tests that look for those personalized type of treatments so we can target the cancer most efficiently and have less side effects.
Okay, and with that, sometimes I know several of us are going to be discussing the genetic testing. How important is that?
Very important, and that's really the last 5-8 years. That's really changed because we're testing for 30 plus genetic syndromes. So if you come to me with a cancer and I find out you have some relatives that have cancers, usually you meet criteria to have genetic testing. And the key to that, it doesn't necessarily change how we treat your cancer from that standpoint, but allows us to screen you better for other cancers, and we're allowed to screen you more aggressively. But also if you have a sister or brother or children, we test them and we're able to prevent them from having cancer or screen them more aggressively to catch something earlier. So that's extremely important. That's one of the things we offer as well.
Okay, and again, I just want to, before we wrap up, I want to talk about screenings are important.
Screenings are absolutely, I'm seeing them on the back end. You need to get it caught as early as possible, and that's where screenings come in, absolutely.
And you see the prognosis being better the earlier that it's caught, because I think I do want to spend, early detection is key. We hear
early
that all the
detection,
time.
absolutely. I mean, you'll see more people survive the earlier, the earlier stages have better survival, and the earlier stages get caught because people are going and having mammograms or having chest x-rays or having pap smears. They're doing what they're supposed to do to get tested, and you're catching things earlier, and they have a better prognosis, absolutely.
So with any cancer,
any
right?
cancer,
All
absolutely.
Of them.
Absolutely.
Well, I want to thank you for being here.
Thank you for having me. I always appreciate it's nice visiting with you today.
Yeah, well, I appreciate you. We're going to take a quick break. Stay tuned, and we'll be right back.
Dr. Anderson was my oncologist for 10 years, and he was the best. I was happy the day he declared me cancer-free and released me, but I told him I would miss the great care and compassion he gave me as a patient.
Welcome back. I'm now joined with Cynthia George, CEO of Horizons. Thank you for being here.
Thank you, Kelly. Great to be here.
Now, many people may be unaware that Horizons is what was formerly the Cancer Coalition.
I'm sure they are, because I've run into that quite a bit since I have been there. But, the Cancer Coalition has such an amazing reputation and has done so much in this community. But a couple of years ago, the board and staff really decided that there were more things that we could be doing in the region that we serve. And so we looked into that to determine what the needs were and decided that we needed to change our name if we were going to do things like diabetic education and other things. So we changed our name to Horizons, but we are still doing all of the work that we were doing previously for the Cancer Coalition and more.
Okay, and I do want to talk about some of that work. We've had a few physicians on talking to us about how important screening is, early detection. Y'all play a key role right here locally on helping patients with screenings. Talk to me about that.
I have been so impressed with the care that our navigators give to patients in our region. My background was in healthcare before I came to Horizons, and I knew some of the challenges that we had in our region, but to see the kind of things that are happening and getting the screening rates up, it's very impressive to me to know that we have that skill that is offered to patients really all over South Georgia. And they work with physicians' offices to identify patients that aren't getting the colorectal screenings or mammograms that they should be getting, and we work with the uninsured predominantly and underinsured patients that wouldn't be able to afford it, might not understand why they need it, and not know what to do. So our navigators help them through that process by working with our partners, hospitals and physician practices.
And that's key, because we see that many people do put off screenings because they don't have insurance, or they don't actually may not realize, like you said, they need screening.
And there's a lot of other things people have to think about that they aren't aware of, and that's like prepping for some of those exams and knowing that you've got to follow up with your physician afterwards. And those navigators really hold the hand of the patient through that whole process and make sure that they follow through and they follow up.
Right, and we're not just talking about colon screenings, we're talking about breast mammograms, things like that as well.
We are. We raise funds in our region, but we receive significant funds from the state through the tobacco settlement, and it helps us pay for those screenings. So we work with hospitals and physicians to provide screenings to patients that normally might not have been able to have them.
Yeah, great. And now, so how does someone get, if someone is watching today and they think, oh, well, I've been putting it off because I don't, how do they get started, or do they call the office?
Well, they can check with their physician and see, if they are, if they haven't been to see their physician, they need to do that. Right. And we encourage our patients not to just ask about colorectal or mammogram screening, but all screenings, and make sure that you are up to date. And then we work with the physician's practices as well to go in and help identify the patients that do need the screening that may have been slipped through the crack or just haven't followed up on their own to have them, so that we can help them identify them, and then we start working with the patient to get them through.
Well, a lot of great work that you do, and we appreciate what you do right here in our own backyard, and I appreciate you being here today. We're going to take a quick break. We're going to take a quick break, and we'll be right back.
Hello, my name is Bill Hardigree. I'm a Lee County resident. I was diagnosed in November, prostate cancer. My doctor recommended Phoebe for their care. I was scared. They took me in and said, hey, it's going to be all right. The whole unit ran like a well-oiled machine. They have the latest equipment, a well-trained staff, and it's just like dealing with family. I'm grateful Phoebe was there, because I would have hated to be up in some other city where I didn't have my friends. I was so fortunate. Every day is a new day.
Welcome back. I'm now at Phoebe Cancer Center, joined by Dr. Johnny, Medical Director of Oncology and Hematology here at Phoebe Cancer Center. Thank you for sitting down with me.
You're welcome. Thank you for having me here.
Today, we're really trying to drive home the point about early screening and detection for cancer. And genetics and genetic testing play a big part in that. Talk to me a little bit about that.
So genetic testing is testing of the genes to diagnose, screen, and possibly implications on the treatment of a patient with either a cancer diagnosis, and there is a lot of other areas where genetic testing is done. It is as simple as taking a drop of blood from a patient or a drop of saliva, and you can actually identify certain genes which may be responsible for the disease process.
Okay, now is this similar to the things you see on television that you order, or the home kits that you do for genetic testing?
Right, so there are certain tests which can be ordered online. The concern with those testing is that we do not know exactly what genes are tested for that particular patient. We don't know about the accuracy and precision of those testing, and there are some concerns about its reliability.
So now y'all do offer here genetic testing.
Correct. So we have one of the 4 programs in the country which is called telegenetics program, and it incorporates pre-test counseling through a genetic certified person. The physician sees the patient during the visit and explains to them why we are doing it, what the implications would be, and how does it relate to their family and their care. And then there's a formal, once we have the test results, there's a formal post-genetic counseling, which is also done here.
Okay, and that brings up a good point, because sometimes you may be genetic testing not only for yourself, but to find something that could help another family member?
Correct. So genetic test is done for several reasons. One is for screening whether a person is going to have cancer or not. Once they have a cancer, if you do the genetic testing, you'll find out whether they are risk for other cancers. And if they are positive, then it has a direct implication on the family members and their relatives too, whether if they are carrying the same gene.
Okay, and simply done, you said, by blood test or saliva, is that correct?
Correct.
And then the results come back fairly quick?
Yeah, usually the turnaround time is between 7 to 10 days.
Okay, and so another thing I want to talk about is you have clinical trials on genetics. Talk to me a little bit about that.
Correct. So once you identify a patient with certain so there are 2 types of results. One is called deleterious mutation, which means that that gene may cause a certain type of cancer. Okay. The other result could be something called variant of unknown significance, means at this point in time we do not know exactly what that implication means, but over the time we may know about what that means to the patient and the family. So once you identify those two subset of patients, then they could participate in something called a national or international trial where there would be a registry of all those patients and they would be followed for good. And as we grow our knowledge, we could inform their family. Otherwise, if they're not on trial, there's a possibility that if they moved somewhere, they may get lost and would not know what exactly would be going on 10 years from now, 15 years from now. So those are the trials which are for follow-ups. There are other type of trials which actually the direct implication is what type of treatment would you choose based on the genetic testing, because there are certain drugs which work in a patient who have certain mutations and there are certain drugs which may not. So it is more target-driven treatment.
Okay, and I'm sure you've seen your years, things advance and research bringing a lot to the table to help patients. Do you see any future expanding things at Phoebe?
Yeah, so we actually participate in the national and international trials. The trials are defined based on what the needs are at the community level or at the national level, and we have access to pretty much all the trials which are happening in the country through something called Minority and Corp Group, which is through National Cancer Institute. And we can do all the trials here at Phoebe, in our backyard, so to speak, which you could do it at one of the academic centers.
And that's great because that's the benefit. They're still here with family and have the support and the resources.
Absolutely. It helps the patient not to have to travel 4 to 6 hours just for a 15-minute visit outside.
And then let's talk about, you hear a lot about immunotherapy. Tell me about that and what that is.
So immunotherapy is, in a way, a newer type of treatment which actually has been researched over the last 10 years, but now it's more prevalent for pretty much all the cancers. It is actually, there are different types of immunotherapy. One is to boost up your immune system to fight out the cancer, or there are immune modulating agents which actually you can give to the patient so that it works against the cancer.
And how important is that with treatment?
It actually is becoming a very critical and integral part of the treatment. As a matter of fact, if you start from top to bottom, from brain cancer to head and neck cancer to esophageal to stomach to kidney to pancreas, some of this cancer is actually the first line treatment is immunotherapy nowadays.
Great. And then all of that is done, again, here you can do it in the cancer center. They don't have to do anything for the therapy?
Absolutely. It can be done here. They do not have to travel elsewhere.
Okay. And so again, we're driving home about prevention and screenings. And so your advice to patients about that front line of defense of screenings, what would you tell patients?
I think we as a physician and all of us believe in prevention is better than cure. And if you can prevent it, then we don't need to worry about treating the disease process. And the genetic testing is one of them where you actually can identify the patient, diagnose before they could do the cancer. For example, a lot of people know about Angelina Jolie's case where she had genetic mutation and she had definitive type of treatment which could potentially prevent cancer. And those are things which we want to incorporate in our practice.
Right, so we want them to get screened and make sure, and then y'all have world-class medicine here as far as it,
Absolutely.
with the cancer treatment. You treat all types of cancer.
Correct.
And then also hematology.
Yeah, we treat from blood disorder, which are called benign disorder like anemias, thrombocytopenias, to all the way up to leukemias. And we also treat solid tumor, which are the cancers we talked about.
Okay. Well, I appreciate your time sitting down with me today and your efforts you do here to help us fight this disease.
Thank you.
I want to thank you for joining us here on Healthcare Today, and remember how important early detection is. Thank you, and we'll see you next time here on Healthcare Today.